The House of Representatives just recently passed a bill that would stiffen the pressure on the sale of tobacco in the U.S. If supported by a veto-proof majority in the Senate, which is made necessary by the Bush administration's threat of a veto of the bill, consumers would find greater government oversight of the product and new, bold, graphic warnings on the cigarette packaging itself, similar to what's been found to be effective in Canada. But while the packages may end up looking different, at least for now, they'll be sold in the same old aisles. Where are cigarettes sold in America? Well, about 2/3 are sold in convenience stores, 11% in grocery stores or supermarkets, 11% in tobacco outlets, and 3% in liquor stores. Where else? Well, this may surprise you. About 4% are sold in the big wholesale clubs and mass merchandisers, and nearly 4% in pharmacies. As you might imagine, the juxtaposition of cigarettes and pharmaceuticals, including some that address nicotine addiction, is an odd one indeed. In fact, a survey of 1,000 California pharmacists found that 82% support a ban on cigarette sales in their pharmacies. A similar conflict exists in the big box retailers like Walmart, which are the foe not only of pharmacies, but of also about 1,000 in-store health clinics across the U.S. Why do they do it? Well, one word: money. In 2007, over 17 billion packs of cigarettes were sold in this country. Grocery stores, drugstores, wholesale clubs, and mass merchandisers were responsible for 13 billion in sales. That's about 20% of the total buy. With that kind of money at stake, it's not surprising that Walmart hasn't budged. They're not taking questions on the issue these days, but in the past, their CEO, Lee Scott, had this to say, quotes, "There are still a tremendous number of our customers who smoke. We've got a market to serve, and second, we have shareholders to think about," close quotes. And the National Association of Chain Drugstores is holding the line as well. Their official position, quotes, "Such a ban would only succeed in making an arbitrary determination as to which retailers would be permitted to sell products that remain legitimately for sale in the state and in the nation," close quotes. But others have broken ranks. Target quit selling tobacco products way back in 1996. A decade later, they say the financial impact has been minimal. And this year, Wegmans Food Market, citing the destructive role smoking plays in health, broke the habit. CVS CEO Tom Ryan hinted this year that they're headed in the same direction. Likely, he has his ears to the road, as states and municipalities across the U.S. this year have begun writing legislation that would unlink the sale of tobacco from outlets that provide health services and medication. These retailers are smart to bite the bullet now. With new graphic images of cancer sharing the packaging with Marlboro and Newport logos, the revenues and sales for these products are going to decline, while the adverse impact on the distributor's image and on their logos will likely grow and grow. For Health Commentary, I'm Mike McGee.